Hello students, welcome to this new lecture. Today we are going to start abdomen. In that our first topic is peritoneum and peritoneal cavity. My name is Dr. Muhammad Sharil KP. So let's get started. What is peritoneum? That's the first thing you need to know. What is peritoneum and why you want to study it? Okay, what's the importance of peritoneum? So what is peritoneum? You know, the largest body cavity in human body is abdominal cavity. Okay, this is it. One second. So this is diaphragm, this is pelvic inlet, pelvic cavity, this is anterior abdominal wall, this is posterior abdominal wall. So all this includes the abdominal cavity. So what is peritoneum? Peritoneum is a membrane that covers the abdominal cavity like this. Okay, so peritoneum is a membrane that covers the abdominal cavity. So why is it important? Why you want to study? So peritoneum is a membrane that covers the abdominal cavity. Okay, what's the purpose of this peritoneum? You know, the abdominal cavity is not like what you see here. This is the cavity, but it has so many organs, large and small organs. Like major part will be coming the liver, then we have stomach is there, duodenum, jejunum, ileum, okay, large intestine, kidney, suprarenal gland, pancreas, spleen. All these organs will be there in this cavity, abdominal cavity. So among these organs, some organs has to move inside this cavity, but some should be fixed. For example, the stomach, duodenum, jejunum, ileum, colon, these all are involved in peristalsis. Peristalsis means when we eat something, it has to go through our esophagus, stomach, all this way. Okay, absorption takes place in different parts of this GIT. So peristalsis helps this food to move forward. So it helps in digestion and absorption. So some of these organs has to move inside, but some should be fixed. They don't have to move inside. So how it is possible? Okay, there comes the importance of peritoneum. Peritoneum helps fixing some organs and helping some organs to move inside this abdominal cavity, also restricting their unwanted movements also. So that's the main importance of peritoneum. Okay, so let's get started into the lecture. So what is peritoneum? Peritoneum is a large serous membrane lining the abdominal cavity. Okay, that we have already mentioned. So peritoneum in histologically means cellular level. Okay, how many layers are there for the peritoneum? It has outer layer and inner layer. Okay, it has outer layer and inner layer. So outer layer, which is fibrous layer. Okay, the main purpose of this fibrous layer is it gives strength to this peritoneal membrane. The inner layer, that's another most important layer, which contains mesothelial cells. Okay, why mesothelial cells? These cells can secrete serous fluid. Okay, serous fluid. This serous fluid lubricates the surface, so it helps in the free movement of organs inside this abdominal cavity. So you're getting the points. The peritoneum, which has two layers, one is outer and other one is inner surface. Outer surface gives its structural strength to this peritoneum, but the inner layer, which is mesothelial cells, which secretes this serous fluid, okay, which is called peritoneal fluid. Okay, this fluid helps in lubricating, which means, as you can see here, I told you abdomen is not like this. It is compactly arranged with all the organs. So if all the organs comes in that cavity, it will be closely contacted. Okay, some organs will be contacted with other. So if these organs collide together, that creates friction, which this friction creates loss of tissues. So in order to prevent that, peritoneal fluid, which helps in this lubricating the surface, so the movement of organs within this abdominal cavity becomes smooth. Okay, you understand this? Okay, now let's get into the next point. Peritoneum is in the form of a closed sac. What is a sac? Just this is a sac. Okay, this is a sac, this is closed sac. Okay, which, so here what you see is the closed sac. Okay, invaginated by number of organs. So see this example. This is our body wall, this is anterior abdominal wall, this is posterior abdominal wall. Below that we have peritoneum. This is our peritoneum. Okay, so peritoneum is like a closed sac. Okay, What's the next point? Invaginated by number of organs. See, this is one organ. Okay, this is viscera means organ. So this is one organ. For example, let it be stomach. So this is stomach. So stomach is invaginated into this peritoneal cavity. See, okay, so it's a closed sac. Okay, invaginated by number of organs. Here stomach is there, here some other organs, here another organ. Okay, so these all are peritoneum. You are getting it right? Okay, so peritoneum is divided into three: parietal layer, visceral layer, and peritoneal folds. The outer layer is parietal layer, inner layer is visceral layer. So what is peritoneal fold? Peritoneal fold is by which organs are suspended, which means this is body wall. Okay, see, this is an organ. Okay, this is the wall. Okay, body wall, anterior abdominal wall or posterior abdominal wall. See, from this anterior abdominal wall, it is hanging like this. Okay, the organ is hanging like this, so this is called fold. So peritoneal fold by which organs are suspended. Let's see this example. So this is abdominal wall, this is peritoneum, this is peritoneal cavity. Okay, this is our viscera or organ. Okay, so from this posterior abdominal wall, peritoneum is suspending stomach. So this is called peritoneal fold. This one is peritoneal fold. You are getting it right? Okay, then we say two layers. Okay, outer parietal layer and inner visceral layer. Okay, suppose I'll tell you one. It's a closed sac. This is peritoneum, this is also peritoneum. Okay, so this is outer, which will be parietal peritoneum. Okay, this is inner, which will be visceral peritoneum. Okay, in this example, can you show parietal peritoneum and visceral peritoneum? This one is parietal peritoneum and this one is visceral peritoneum. So this visceral peritoneum and parietal peritoneum is connected by peritoneal fold. I'll explain to you later what is this mesentery. Okay, so I guess you understood the point. Okay, let's get into the next topic. So parietal peritoneum, which lines the inner surface of the abdomen and pelvic wall and lower surface of the diaphragm. So this is the abdominal wall, this is lower surface of diaphragm, this is pelvic wall. So this is what I have drawn is parietal peritoneum. Okay, so in parietal peritoneum, the blood supply and the nerve supply are same as those of the overlying body wall. Okay, which means if this portion of your abdomen is given by a blood with artery and nerve, it is the same artery which supplies this portion of parietal peritoneum also. Okay, this parietal peritoneum is pain sensitive, which means you can feel the pain. For example, if an infection has occurred to this peritoneal part, you will get pain here, because here and here the nerve supply is same. Okay, so let's discuss this diagram. Okay, what you can see, this blue line is your parietal peritoneum. Okay, this blue line covering an organ is your visceral peritoneum. Okay, so this is parietal peritoneum, this is visceral peritoneum. Can you see this? This is peritoneal fold. Okay, so we have multiple organs. This is liver, this is stomach, this is colon, this is intestine, small intestine. So all these organs are arranged in your peritoneal cavity by this peritoneum only. Okay. Next, visceral peritoneum. Visceral peritoneum lines the outer surface of the viscera. Viscera means organ. So this visceral peritoneum, its blood supply and nerve supply are same as those of underlying viscera. Okay. So when an organ is stretched or ischemic means it's not getting enough blood supply and oxygen. Okay, like myocardial infarction, heart attack, that's one kind of ischemia. Or if this organ is distended, you can feel pain. Okay, so let's discuss the folds of peritoneum. Organs are suspended by folds of peritoneum. Okay, we have discussed this before. So those organs which are suspended by these folds of peritoneum, these organs will be mobile, that can move inside this abdominal cavity. On the other hand, those organs which rest directly on the posterior abdominal wall, which is fixed and immobile. So it has no peritoneal fold, it's fixed in the posterior abdominal wall, so it can't move inside your abdominal cavity. So in those organs are covered by peritoneum only on one side. Okay, these organs are called retroperitoneal organs. Okay, I'll show you one example. See, what is this? It's duodenum. Okay, can you show me? This is duodenum. See, this is peritoneum. Peritoneum is only on the one surface. What's in the opposite surface? This is posterior abdominal wall. So duodenum is fixed to the posterior abdominal wall and it has peritoneal covering only on one side. So duodenum can't move inside your abdominal cavity, whereas this is small intestine, this is stomach, this is colon. So all these organs can move inside your abdominal cavity. How is it that possible? Because of peritoneal folds. Okay. So what are retroperitoneal organs? These organs, retro means behind, okay, back. Peritoneal means peritoneum. So these are organs present behind the peritoneum. See, this is peritoneum. Behind the peritoneum is duodenum. So retroperitoneal. Okay. Intraperitoneal organs means organs which are covered by peritoneum. We have discussed it. Okay. So see examples: retroperitoneal organs, pancreas, kidney, ureter, duodenum. So intraperitoneal, stomach, jejunum, ileum, cecum, appendix, all these are intraperitoneal organs. So one function of this peritoneum is this one. For example, I'll show you a diagram. See, this is your aorta. Okay, this is your stomach. This is abdominal cavity. So this stomach has to receive blood supply. So from where it receives? Aorta only. So do you think aorta blood vessels can go like this? If it goes like this, it will be in the abdominal cavity, it will be freely moving there, which can cause so many problems, like blockage can happen to this blood vessel, all those problems can occur. Okay, so what this peritoneum is doing is, anyway peritoneum is connected with these organs. Okay, this is peritoneum. So these blood vessels pass through this peritoneum. Okay, so blood vessel pass through this peritoneum. So without much of complications, these organs will receive its blood supply, nerve supply, and nerve supply. Okay, and lymphatics too. Okay, so we are discussing peritoneal fold. Okay, so tell me some examples of peritoneal fold. Okay, have you heard about mesentery? Mesentery means it's a peritoneal fold of small intestine. Mesocolon, peritoneal fold of colon. Omentum, peritoneal fold of stomach. You need to learn these names. Okay, we'll be discussing it many times. So next is ligaments of peritoneum. What is ligaments of peritoneum? Okay, ligaments of peritoneum are double layer of peritoneal fold. Okay, that connects organ to abdominal wall or to other organs. Okay, peritoneal fold, we have discussed that from this abdomen it connects an organ. So ligament is double layered, okay, which either connects to abdominal wall or which connects two organs. Okay, gastrosplenic ligament. Gastro means stomach, splenic means spleen. So this ligament connects stomach and spleen. Okay, in this diagram, see, this one is spleen, this is stomach. So the peritoneal fold that connecting stomach and spleen is gastrosplenic ligament. Okay, see other example, spleno-renal ligament, which connects spleen, renal, kidney, these two. Okay, this one is spleno-renal ligament. Okay, so let's get into the next topic, peritoneal cavity. So what is peritoneal cavity? Okay, see, this is peritoneal cavity. Okay, but we have divided this, one second, this is peritoneal, this one is peritoneal cavity. We have divided this peritoneal cavity into two. Okay, one is lesser sac, the other one is greater sac. Okay, we'll discuss detail here. So peritoneal cavity is divided into two. One is greater sac, which is larger, the other one is lesser sac, which is smaller. Okay, where is lesser sac seen? Which is behind stomach, lesser omentum and liver. Okay, what is lesser omentum? I have told you omentum. What is lesser omentum? So omentum is peritoneal fold of stomach. Okay, for example, this is stomach. Okay, so stomach has peritoneal fold. This is stomach's lesser curvature, this is stomach's greater curvature. The peritoneal fold that connecting the lesser curvature is lesser omentum. So the peritoneum that covers the greater curvature is greater omentum. We'll discuss detailed in another section. Okay, so now this lesser omentum, so lesser sac is seen behind stomach, lesser omentum and liver. Okay, so now we know that there is two. Now we know that the peritoneal cavity is divided into two, which is lesser sac and greater sac. So there is a communication between this lesser sac and greater sac. See, communicates each other through epiploic foramen. So epiploic foramen is just an opening that connects lesser sac and greater sac. Okay, I'll show you this example. So this is our abdominal cavity. This is liver, stomach, colon, small intestine. Okay, this is duodenum as we mentioned. See, all of this is peritoneal cavity, which is divided into two, greater sac and lesser sac. See, this one is lesser sac. Okay, behind the stomach and liver. Okay, the other portion, the bigger portion, which is the greater sac. So I told you there is connection between greater sac and lesser sac. See, this one, this opening is called epiploic foramen. Okay, so the connection between these two sac is epiploic foramen, otherwise known as foramen of Winslow, or opening into lesser sac. Okay, see the other picture. This is transsectional picture. Means if you cut like this and see from here, this is how you can see. Okay, stomach, this color is greater sac, this is lesser sac. See this opening, this is epiploic foramen or foramen of Winslow. Okay, so now let's discuss the functions of peritoneum. Okay, what is the main function of this peritoneum? The main function is movement of viscera, which I have discussed before. Okay, what it do is it gives a slippery surface for the movement of abdominal organs. So if an abdominal organ has to move inside over the other organ, in between them there will be a fluid called peritoneal fluid, so it will reduce the friction while moving this. Okay, so it also helps in peristalsis. Okay, so what's the next function? Next function is protection of viscera. How? Actually, the peritoneum contains phagocytic cells and peritoneal fluid contains lymphocytes. Do you know what is phagocytes and lymphocytes? These are our white blood cells. Okay, so this helps in fighting against the bacteria or any other antigen. Okay, and the other mechanism by which peritoneum helps in protection is, have you heard about policeman of abdomen? Suppose this is your abdomen. Okay, you have an infection here. For example, you have appendicitis. Okay, and infection is there. Okay, and appendix got ruptured. So what the greater omentum do is, what is greater omentum? It is the peritoneum that covers the greater curvature of stomach. Okay, greater omentum comes here and seal this place. Okay, if it seals this place, which means infection from this place can't move to any other place. Okay, so this place is contained, like our lockdown situation now. If you are not moving, the infection can't spread to other place. So during this time, our immunity can come here, like macrophages and other immune cells can come here and repair this infection also. Okay, so that's why greater omentum is called policeman of abdomen. Okay, what's the next function? Absorption and dialysis. I have mentioned that mesothelium. Mesothelium means peritoneum has two layers. One is fibrous and another one is mesothelial cells. So these mesothelial cells, which is semi-permeable. You know, semi-permeable solutes can, not the solute, solvent can pass through it. Okay, so fluid from this peritoneum can be absorbed to blood vessels through them, which means if this is your abdomen, here you have some fluids. Okay, you have peritoneum here. These fluids can be absorbed into this peritoneum. Okay, and this peritoneal fold contains what I told you before, blood vessels. So this will be absorbed into this blood vessel and carried to our circulatory system. Okay, so in that case, see, fluid can be administered through this route. For example, actually how we are administering fluid? Through IV only, right? Okay, in your hand you pick an IV line and fluid is injected into your body. Okay, but in some extreme cases, if you don't have any other ways, what you can do is you can give this fluid through your abdomen. So when fluid enters into this peritoneal cavity, this fluid will be reabsorbed by the peritoneum into our circulatory system. Okay, so what is peritoneal dialysis? Right now what we said is we can give fluid into the peritoneum, so it will go to circulatory system. Think the other way. From the circulatory system, fluid will come into the peritoneum, and from there you can take this fluid out from the body. So when is it works? For example, have you heard about in renal patients we are doing dialysis, right? So this is one way of doing dialysis, because urea from our blood can be removed through this peritoneal fluid. Okay, that's how dialysis is done. Okay, next function is storage of fat. Large amount of fat can be stored in peritoneum. Next is healing power. So the mesothelial cells I have discussed before, they can transform into fibroblast cells. Okay, these fibroblast cells can help in healing. So now let's discuss the clinical anatomy. Okay, what is ascites? Ascites is the collection of fluid in the peritoneal cavity. Okay, see this diagram. This is our normal abdomen. See, fluid is accumulated in abdominal cavity. This is called ascites. So when does it occur? The major causes is liver cirrhosis, which usually occur in alcoholics. Then TB patients, peritonitis, TB peritonitis. Okay, tuberculous infection of peritoneum. then congestive cardiac failure, then cancer affecting peritoneum. Cancer affecting peritoneum. So now what's paracentesis? Paracentesis is fluid from the peritoneal cavity is removed by puncturing the abdominal wall. See, this is the abdominal wall. We are introducing a catheter and fluid from this abdominal cavity is taken out. This procedure is called paracentesis. Peritonitis. Peritonitis means infection or inflammation of this peritoneum. Pneumoperitoneum. Pneumoperitoneum means peritoneal cavity contains air. Okay. So usually it's seen in stomach or intestinal perforation. Okay. Then what's laparoscopy? Laparoscopy is the examination of peritoneal cavity with laparoscope. Then peritoneal dialysis. I have just discussed it. Peritoneal dialysis here. Okay. That's all for today's lecture. Thank you.